Hello, everyone, and thank you so much for tuning in to today's webinar. My name is Annika Jarwa. I'm 16 years old and currently studying in grade 10 at Chatham Ladies College in the UK. I was diagnosed with celiac disease when I was 8 years old, and as a result of this, I founded GlutenFree Jio, a social platform that is dedicated to providing access and information and resources regarding celiac disease and living a gluten-free lifestyle in India. Please keep in mind this webinar is being recorded. The link to the recording will be shared shortly after the webinar. I request all attendees to keep their mic muted during the session. There will be a Q&A at the end, and please type in any questions that you have. We shall take them at the end of the session as time permits. We will start off with introductions, a bit about GlutenFree Jio, insights by Dr. Charanpreet Grewal, a Q&A, and resources provided by GlutenFree Jio at the end. Dr. Grewal is currently practicing in Punjab, and he is active in conducting awareness camps and campaigns aside from his busy schedule. He has an M.B.B.S and M.D. in medicine, a DM in gastroenterology from the DMC in Ludhiana, a fellowship in Interventional Gastroenterology from Medanta The Medicity, an MRCP in gastroenterology from the UK, and was formerly in the PGI Chandigarh, and is also a consultant in gastroenterology. GlutenFree Jio is a social project that seeks to increase awareness and access to information on celiac disease and living a gluten-free lifestyle in India. Our mission is to create awareness by conducting information sessions in collaboration with schools and to promote testing and diagnosis for families from diverse backgrounds in partnership with local diagnostic facilities, and to provide resources, tips, and materials to help celiacs lead a healthy gluten-free lifestyle. We've conducted workshops in over 12 schools and virtually connected 100 schools across Chandigarh and Punjab to increase awareness. We have reached out to over 1,000 students. The Mayor of Chandigarh has also attended our session and recognized GlutenFree Jio for its work in 2019. Gurbakhsh Rawat, the councillor and ex-deputy mayor of Chandigarh, also applauded our work done during the pandemic this year in 2020. We have developed free educational resources, including a children's book, blog, and educational videos to promote awareness and access to information on celiac disease. GlutenFree Jio now has a community of over 13,000 followers on social media and growing. We have also developed an app to increase access to gluten-free resources, such as restaurants serving gluten-free food and grocery stores which carry gluten-free supplies. And now to what we're all here for today, the latest research and insights into celiac disease with Dr. Grewal. Thank you so much for joining us, Dr. Grewal. Hope you're doing well. So I wanted to start by asking you, how do you determine which patient may potentially be suffering from celiac disease, considering there's over 300 different symptoms?
Hello, Annika. It's a great time to have a webinar with you. I hope everybody could hear me well. And so first of all, Annika has given an introduction for me, and I'm practicing in Punjab, and I'm running clinics in various cities. So we come across with the patients who have various types of symptoms, as you mentioned, around 300 plus symptoms. You need to have a high index of suspicion, knowing the prevalence of the disease. In Punjab, there has been a study which has been conducted by DMC, and they have found around 2% prevalence of celiac. So what the thing is, it's pretty common, and people are getting aware day by day about this disease. So in routine, we, especially people who come with anemia or gastrointestinal symptoms, and even in old people, we've seen old 70 years old lady coming to us, and she is complaining of some vague abdominal problems like abdominal discomfort, dyspepsia, or other things, and we get a routine antibody TTG test, and we find it positive. So it's you just need to see the prevalence, and you need to have a high index of suspicion, and you can go for serological testing, and it's a minimally invasive test. It's just a blood sample you have to give.
So you mentioned the TTG test as well. So what are the other diagnostic measures that you advise for a patient? Like, is there a specific protocol that you follow to help diagnose a person if you have suspicions that they may be suffering from celiac?
Okay. First of all, a good clinical examination. You need to see the patient. You need to take a good, careful history. You need to ask questions. There are a few leading questions. Since how long the symptoms are there, any aggravation of symptoms, and then you need to see whether patient is emaciated, malnourished, anemic, has some abdominal discomfort or tenderness, or labs. You see the labs, you normally show anemic picture, iron deficiency, vitamin D deficiency, vitamin B12 deficiency, then hypoproteinemic patients. So you see increased platelet counts, which is a sign sometimes we notice. And then you go for the serological investigations like TTG in children who are less than 2 years old. IgG DGP is one of the investigations which should be done, and especially IgA deficient people who are immunoglobulin deficient, we normally avoid getting IgA TTG, we get IgG TTG, right? Yeah. So these are the few things. So commonly we go for the serological investigation. If it is positive, then we need to go for a endoscopy and a biopsy. Biopsy will actually tell us about the grading of celiac according to, there's a Marsh grading where we have type 3, A, B, and C, and 1 and 2. So this is how actually, we follow the protocol.
Right. So yeah, before I was diagnosed, when I did get my TTG test, my number was 149. And then my doctor also suggested that I get a biopsy. And in the biopsy, the results were that my villi was extremely damaged. And that kind of leads on to my next question. Does your small intestine ever completely recover from all the gluten that has been damaging it over the years, depending on however long you've had it?
There is evidence now that on a 12-month strict gluten-free diet, I would say strict gluten-free diet, because there's sometimes a lot of adulteration in foods and people take. There is definitely mucosal healing which is seen, but in few cases where there is no mucosal healing, either the patient is having ongoing gluten ingestion, or is probably suffering from refractory celiac disease. So these are the exclusions, but normally there's a healing happens in around 1 year, maximum to 3 years.
So could you please elaborate on what's refractory celiac disease and how is that different from if you're suffering normally from celiac?
So suppose a patient is on gluten-free diet, strict gluten-free diet for 1 year, and the symptoms of diarrhea, malabsorption are still persisting. So we need to have we see the TTG, and TTG serology we see is normally it's negative. So we go for a biopsy and we see whether there is a CD3 plus CD3 8, and refractory celiac disease is basically when patient is on a gluten-free diet but still not responding. So it's of two types. It's type 1 and type 2. Type 2 is basically a monoclonal proliferation of the intestinal epithelial lymphocytes. And how do we differentiate is you have to do the molecular phenotyping of the CD3 and CD8 plus cells.
Right. So yeah, so personally for me, after I had my first initial biopsy, after I was diagnosed, I didn't have another one to see how my intestine had healed, but I feel I could see the recovery about after 8 or 9 months, because I was one of the shortest and skinniest kids in my class because I just wasn't receiving the right nourishment for my body. But then I did start to grow and put on a few pounds. I feel, yeah, after 8 to 9 months, you can really see. And also I kept having the TTG test every month for the first 2 years till it went completely down 20. So what do you suggest after a patient has been diagnosed? What course of action do they need to take to monitor that their body is healing? Do they do the TTG monthly or another biopsy?
We do a biopsy, yes, but in routine clinical practice, we first see the resolution of the symptoms. what symptoms are present in the patient, and on gluten-free diet, whether the symptoms have resolved. Secondly, yes, we do a TTG, which may be once in 2 months or 3 months, and we see whether it is the levels have come down or not. And then, yes, after a year on strict gluten-free diet, we can do a biopsy. In pediatric population, we can avoid doing a biopsy because, in pediatric, very small children, we prefer to avoid doing endoscopy, and we do it probably when the child grows. And definitely you have to document mucosal healing, because if there is no mucosal healing, then we have to think of other causes as well. Other causes, there are so many GI diseases, intestinal lymphoma, giardiasis, and other diseases which can mimic like the biopsy report of celiac. So yes, we do monitor these patients and keep them on a regular follow-up.
So after being diagnosed with celiac disease, are there any known medically approved treatments besides going on a gluten-free diet that can help you heal?
Yeah, I've been actually reading few of the new medical treatments. One, they're coming up with a vaccine, and there's a drug which is on the final phases of trial, which is known as lorazzotide. Lorazzotide is a drug which, there's a zonulin protein, which, keeps the cells binded to each other. So what happens when the zonulin degrades, the cell, there's a space between the cells, and the gluten, it gets translocates into the lamina propria. Lamina propria is basically a second layer, of epithelium. So there, a lot of immune cells are there. So it exposes, the gluten to those immune cells, and which get activated and triggered the destruction of the mucosa. So what happens is lorazzotide helps in keeping the cells bound to each other and preventing the gluten translocation. So it is, but they have seen that it only prevents when people get, small doses of gluten, which, maybe adulteration or something, and it prevents in that, but it's not 100% protective. Then there's a TTG, there are enzymes they're looking which can digest gluten in the stomach and, prevent the gluten causing injury to the duodenum or small intestine. And then there's a vaccine, and then there's a nanoparticle they are looking into. The nanoparticle which will coat the gluten and prevent the exposure of gluten into the intestine. And there's another genetic variants of wheat they are looking, which are gluten-free.
So currently the pill that you mentioned, the first one, forgive me, I forget the name, but so if you're having the pill, you're saying basically essentially you cannot have like a full piece of cake as a celiac. It's mainly to prevent your body being affected if there's cross-contamination or one of those things. You can't fully go back to having gluten.
Pardon, I didn't get your question.
So I mean, in the sense, the pill is still not going to allow a celiac person to fully go back on having gluten. It's mainly to
yeah, there are a lot of trials going on. The pill might prevent, and there are another drugs they're looking into modulating the immune system so that the immune system doesn't recognize gluten as a foreign antigen.
Right. So many people in India talk about homeopathy. I feel it's one of the favored forms of medication rather than just going to the doctor. So what are your views on the link between people thinking that homeopathy can treat celiac disease?
There is no such evidence of homeopathy, treating celiac patients, but rather, I don't know, people go for alternative medications, alternative advice, and some people, I've very commonly seen my patients, starting gluten again and saying, no, we are fine now. So we had, allergy, and now we are fine. But actually, it's not true. People need to consult the doctor. People need to be very free in going to the doctor. People tend to go for home remedies, homeopathy, or other short I would say shortcuts to for the treatment. But I think it's very relevant to go to a gastroenterologist, a qualified gastroenterologist, discuss the problem and follow his advice. I think that's the best thing people can do. That's what we tell people every time.
Do you feel that due to a lack of awareness, specifically in India, regarding celiac disease, that people feel it's okay to go back to gluten? Is that the main root cause of that problem, or is there any other things regarding that problem of people just going back to gluten?
There are 2-3 things. One is the cost of TTG. It is around rupees 1,000 plus, right? So some people, have economic issues and they don't get the testing done frequently, and they tend to miss it. Other thing is lack of awareness. Yes, we are making people aware. Nowadays in Punjab, I've seen people, especially in villages, are getting very much aware about wheat allergy. They, call it as wheat allergy, but it is, wheat allergy is a totally different entity. But still, at least people know there is something related to wheat or gluten which can cause a disease. So we are making them aware. Doctors are making them aware, and even doctors are getting aware. I've seen even general practitioners, even the homeopathic physicians and other physicians, they get this TTG testing done.
Yeah, I completely agree with the part about even doctors getting aware, because 6 years ago when I was diagnosed, I wasn't actually diagnosed in India. I was misdiagnosed with typhoid because my immune system was compromised due to the gluten in my body, because obviously not being able to absorb the nutrients. So then I was just falling sick due to that, but obviously that was just linked as an after effect of my celiac disease. So then I actually got diagnosed by my pediatrician abroad, where she just said you need to do a TTG test, because it was just that level of awareness was so much higher than in India. But yeah, definitely over the past 5 to 6 years, it's increased. So on the gluten spectrum, you would say maybe celiac disease is up here being the most severe, and then there's gluten intolerance, and then, as you mentioned, wheat allergy. So what is the difference in celiac disease and gluten intolerance? And then is wheat allergy actually another type of like disease linked to wheat, or is it just a layman's term?
Okay, so I'll just tell you there are 3 things related to gluten. One is celiac disease, which we have already discussed. Second is a non-celiac gluten sensitivity. Okay, so this is something which we see in people who are taking wheat and they experience some symptoms like IBS like symptoms. Okay, so what they have found is that it is actually not related to the gluten. It is related to the fructans. Fructans is a type of sugar which we normally call as the FODMAP. FODMAP is a fermentable oligomonosaccharide and polyols, right? So these are the FODMAPs, are responsible for IBS-like symptoms, and when these people leave wheat and their symptoms resolve, basically. And in these patients, it's a very common thing which we have seen, especially in IBS patients. When we tell them to stop wheat, their symptoms improve. So they think they have wheat allergy or celiac, but the TTG is negative. The biopsy is normal. So that is a entity which is called as a non-celiac gluten sensitivity. Regarding the wheat allergy, there is this entity is basically it's a IgE mediated allergic reaction to the wheat, right? So
Right.
this is very common with the cow's milk and with peanuts, and to lesser extent with the wheat. Sometimes people have allergic reaction, but this reaction normally fades away with time, and the TTG again is negative.
Right. So are there other autoimmune disorders, or just other diseases in general linked to celiac disease that celiacs may be more prone to getting?
Celiac, like any autoimmune disease, is a autoimmune disease, and there are a lot of autoimmune diseases which are linked to celiac. You can have diabetes, you can have other, hypothyroidism, you can have other autoimmune diseases, you can have dermatitis herpetiformis, which is a kind of rash on the extensor surface, which is a diagnostic test, thing. Clinically, you can diagnose that the patient has celiac. Vitiligo is very common. You have a hypopigmentation of the skin, hair fall, other things. So a lot of autoimmune diseases are related to celiac.
So also, what about gluten specifically in medicines? Like, how should one approach going to buy medicines? Because usually like a paracetamol or those you're not really going to go ask a doctor for it if you're just having a normal headache. So is that because usually there's like all this stigma around the coating of pills and also binding agents used for cough syrups?
Normally the medicines, the capsules are basically made of gelatin or the rice protein. So there is less chances of having gluten exposure with the capsule. So gelatin is something which is not, having gluten. And other thing is, you should definitely buy a good brand of medication, a good brand, and you should check in the ingredient details, especially, when you take some powders or laxatives or some, high fiber agents, especially, you oatmeal or something. So those have contamination of gluten in them.
Right. So did you mention oat?
Oatmeal, yes. You see oats don't have gluten as such.
Yeah,
but the
because that's quite a
oatmeal
common.
oatmeal has contamination of gluten.
Okay. So, and also with oats in general, you know how there's a whole thing that if oats are actually naturally gluten-free, if not grown in the same field as the wheat crop. So is that true?
Oats are as they are gluten free, but the contamination is always there because in the farm you don't know how they are being made and how much the purification is done.
Right.
So there is some chances of contamination.
And so going on a gluten-free diet, does that mean a person may have other nutritional deficiencies because of a lack of some of the nutrients by going on a gluten-free diet?
On gluten-free diet, there is no as such, deficiency, nutritional deficiency. But yes, in celiac, as such, people get a lot of nutritional deficiencies. So we tend to supplement them with vitamins, minerals, and vitamin D, B12, and other things. Ideally, they should be getting some fortification of vitamins and nutrients.
Thank you so much for your insights. And now we're going to open the floor to the audience for questions.
Yeah.
So someone has asked that they've been gluten intolerant for the past 12 years, and they can't tolerate gluten at all. But they said that they still keep getting muscular pain, which was like a symptom before. So is that because of the gluten intolerance, or could it just be something completely different?
Do they have celiac or NTTG positive?
They just said that they're gluten intolerant.
So they could be non-celiac gluten sensitivity, right? And muscular pains, we have seen with vitamin E deficiency, vitamin D deficiency. So they could be vitamin E or D deficient, right? But that doesn't mean that it's because of the gluten intolerance.
Someone has asked, how is functional medicine's approach different to conventional medicines in regards to celiac disease?
Functional medicine, I would say, we practice evidence-based medicine, right? Whatever we are talking has been researched and it's been tried on patients on, scientific basis. So it's an evidence-based medicine. Functional medicines, we don't know, how they've, practiced and how they have brought it into the market.
Someone has asked, what is a leaky gut? I've heard a lot about this term as well, but I'm not extremely.
Yeah. This is a very interesting question they have asked. Leaky gut is, leaky gut is basically there is a gut liver axis, right? Everything which is absorbed from the intestine actually goes into the portal vein and then goes to the liver, and where it is digested or mobilized into various parts of the body. But leaky gut is gluten is known to cause, I was just talking about the zonulin protein, which binds the cells. So when the zonulin disintegrates, the gut becomes leaky, and the proteins, they go into the lamina propria and activate the immune system. So it is known to cause leaky gut, gluten.
Someone is saying, are there more celiacs diagnosed now due to the hybrid variety of wheat and extensive use of pesticides?
Pesticides as such have no role. Hybrid variety, yes, there are studies which say the hybrid variety is actually causing more exposure to gluten. Yes.
Um, oh yeah, so this is really interesting question. It says, is celiac disease more prevalent in Punjab and more people are diagnosed, whereas maybe, compared to South India, because there's wheat is the staple crop of our diet, whereas in South India, rice is. So do you see more patients here, and is that a cause of it?
There are 2-3 reasons. One is our genetic similarity is more towards the Middle East. Wheat was first grown in Turkey. There's a history. If you read, wheat is not a native crop of India or Punjab. It came from Turkey. So Turkey was the 3500 BC. Wheat was grown in Turkey in this small civilization. So that is how it came into India. So, and our ancestors are also from Middle East. We are the Aryans, and the South Indian people, they have a different genetic. They are the real Indians, I would say, and the native Indians. So, and plus they are the rice-eating population. So that's the one reason where we found more of a tropical sprue than the celiac sprue. Celiac sprue is more common in Punjab. That's the one reason. And especially we are a wheat producing state, and we are totally dependent on wheat as a staple food.
Right. So someone has asked, how far are we from a cure for celiac disease, or is that even possible?
A lot of things are possible. Last year we were not aware of COVID being a very serious thing. And by March we had a lockdown, and now probably you are in UK, you are facing a different strain, and we have come up with a vaccine. Definitely with time and new studies, new research is coming. Maybe we'll have some sort of solution to it in coming years.
So someone has asked that the maize flour has also been causing them problems. And, is that, so I mean, for maize, I used to make my roti at home. I use a different mixture of grains, but maize, as we had a conversation earlier as well, that if you're buying it from the market, it could be mixed, right, with other flours because of the same grinder as well.
The normal chakki, atta which people procure is always adulterated because they don't, follow proper precautions. But maize itself can cause, as a FODMAP, I was talking about FODMAP, which is fermentable oligodie, monosaccharide and polyol. So it can cause IBS-like symptoms, the same way non-celiac gluten sensitivity. Right. So otherwise, it's not, it doesn't have gluten.
Otherwise, specifically for just buying flours, if you're celiac or even gluten intolerant in the market, I think it's really important to be cautious, and it's just better to grind your own flour at home because, as you said, they'd be adulterated. Like even besan is naturally gluten-free, but I remember when I was diagnosed initially, I wanted to make a chila, but I went and bought the flour from the market, and I actually felt quite sick after it because it was obviously mixed in with the other grains.
Yeah, especially with the people who are into producing flour, so they are not very much aware about the celiac and gluten-free. But in now slowly they are coming out with the gluten-free atta and those things. But yes, there is definitely adulteration. So we recommend patients to have their own grinder and make their own flour at home.
So can gluten also cause a leaky gut for someone who's not suffering from celiac disease?
Yes, it is known to cause leaky gut. It's actually it causes, but in somebody who doesn't have celiac, it doesn't activate the immune system.
So this is a really interesting question. Someone has said, can we rely on products that mention that they're gluten-free? And I'm assuming this is obviously specifically for Indian, because outside in the US or even the UK, when it's marked GF, it is GF because it's FDA approved and stuff as well. So what are your views on that?
There's always a, in India, the food laws are not very strict. You have adulteration in everything, in food and water and everywhere in the air. So it's, I would say if somebody is writing as gluten-free, so it probably they would have followed all the protocols and checked. Another interesting thing is, if you take the intake is less than 10 parts per million of gluten, so you don't get activation of the immune system. So normally the recommended dose is less than 10 ppm.
Yeah, and I would say a really good Indian brand to use if you don't want to like buy a European brand is We Are Free, because their factory they have all the permits and they've been tested, as you mentioned, less than the 10 parts per million, and they take extreme precautions in the factory. So that people actually wear the PPE kits way before COVID to make sure that there's no contamination at all.
I would, if a factory has all the recommended approvals and they are following it, the protocols nicely, then I think we can rely on them.
Someone has asked, is there a link between celiac disease and type 2 diabetes?
There's a link between type 1 diabetes and celiac.
Okay, so what?
But celiac can cause, yes, insulin resistance and obesity and other metabolic syndrome.
Can untreated celiac disease lead to more serious illnesses?
Yes, untreated celiac, we always tell our patients to follow a strict gluten-free diet, because untreated celiac can lead to cancer of the intestine. It can lead to lymphoma of the intestine. It can cause liver disease, chronic liver disease, liver cirrhosis. 2% of the liver cirrhosis cause is celiac. So it can lead to serious problems, but yes, the percentage is quite less, but it can lead to cancer.
So what is that, just because your body is going to be like really immunosuppressed, or is that?
No, it's not immunosuppressed. It's a continuous activation of the immune system, which leads on to uncontrolled proliferation of the cells, which causes cancer.
So this is quite interesting, it's quite relevant to today's current atmosphere in the world, do celiac patients need to be more careful about COVID?
If they are, if they're malnourished, if they are weak, if they are immunocompromised, yes, they are definitely.
Okay, and for our last question from the audience, what level of nutrition should gluten-free flours have? Because I'm assuming obviously it might not be as nutritious as the wheat flour.
No, I didn't get what level of nutrition.
So someone is asking what level of nutrition should gluten-free flours have. So I'm assuming they're asking that because would you need to use more grains to make it more nutritious compared to like when the wheat flour is just one specific crop?
So if you talk about nutrition, there are three components. One is carbohydrates, one is fats, one is proteins, and another is vitamins. So gluten is just one part of the protein. You can take other proteins that makes the food nutritious. You can have paneer, you can have chicken, you can have fish, you can have multivitamins as supplementation, and vitamin D and B12 deficiency, which is very common in Punjab and in general population. So you should always have a supplementation of that.
Right.
So nowadays you get fortified attas. Fortification is, or they're already supplemented with the vitamins and minerals.
I said that was our last question, but this one is too interesting to let go. It says, what is the genetic testing required for celiac disease? Because it is a gene present in us since we're born.
Yeah. Suppose somebody is really concerned, somebody has a borderline TTG, somebody has symptoms, somebody has is very apprehensive, that probably I have celiac, my test is borderline. A very interesting fact is in cirrhotic patients, sometimes due to the leaky gut, you can have a borderline TTG. So sometimes you feel you might have celiac, but the biopsy comes out to be normal. So there is then what happens is that you go for HLA DQ2 DQ8. So if HLA DQ2 DQ8 is negative, it's not present, then celiac is ruled out. Right. So that's the genetic testing.
So for example, I was diagnosed when I was around 8 or 9, but then obviously I had that gene since I was born. Then how does it get triggered to actually start having the symptoms?
2 to 3% of the HLA, 2 to I would say 5% of HLA DQ2 DQ8 positive people can have celiac, but not everybody.
Okay. So thank you so much, Dr. Grewal, for your insights. Thank you for taking time out of your busy schedule to speak with us, and thank you
everyone. Very much.
And thank you everyone.
Nice talking to you.
It's really nice. And thank you everyone for attending. I think we've all learned a tremendous amount about the latest developments in the work of research regarding celiac disease and are hopefully better informed about it. Whether you're a celiac yourself or helping a loved one who has celiac, it is important to note that there's a community of others who are in the same boat and that there are various resources and alternatives which allow you to live your best gluten-free life. Please do check out the work we are doing on my website at www.glutenfreegio.com, which has great free resources, including handy gluten-free tips, and stay tuned for my upcoming app and recipe. Thank you, everyone, and hope you have a really good day.